Good afternoon. My name is Rhoda Howell Gonzalez. I am the dental hygienist contracted with Anthem to come out and provide fluoride varnish certification and trainings. So that way you feel comfortable in not only taking a look inside a child's mouth before you apply the fluoride varnish, but also feel completely confident in applying a fluoride varnish to a child. So the measure with the Department of Healthcare Services is that children 0 to 6 will receive TFC, which is topical fluoride for children. And the measure is 99188 CPT code, reimbursed 3 times a year. And it's perfectly safe if the parent says, hey, my child just had it at the dentist. It's a different code that the dentist uses than what the medical doctor uses. So you can both do it and it's perfectly safe. It's not toxic. The reason why, so cavities are contagious. Babies aren't born with the bacteria that causes cavities. They acquire it from family members, caregivers, parents, and having this conversation with a parent at a young age about this is why it's good to wipe the teeth. This is why it's good if you're a mom or if you're pregnant and if you're going to have another child. And if you have untreated cavities, get those treated, because the more untreated cavities and bacteria you have in your mouth, the more you're going to pass on to your child. So that's one of the conversations you have, right? Like, hey mom, we're going to do this new thing. It's called fluoride varnish. It's basically a vitamin for your child's teeth. It's technically a mineral. But when I explain it to kiddos or parents, I'm like, it's basically a vitamin. It helps harden the enamel. What you're going to do is you're going to take a look at the teeth. And this is a picture, and you guys, I will send this to Christina. She can make a copy, and you guys can have copies of this. What you want to do is you do not want to apply fluoride varnish to teeth that have, we can't diagnose, but we can have suspicious areas. So if you open a mouth and there's a lot of these little suspicious areas, those are contraindicated for fluoride varnish, just because it can sting if it's on there. This is what a normal, healthy mouth will look like. This is the beginning stages of decay. So that's important to see, because if you see a child's mouth and they have bumps like that, that's an abscess. They need to go out to the dentist right away. If they have areas like this, you've got many suspicious areas, we need to refer you out to a dentist. These little areas here, we see a lot of our little ones with white decalcification. And then once it breaks through the enamel, it will look like this, and that's actually active decay. You can still apply fluoride varnish there at those areas. And a lot of times, it will put in a holding pattern until they go to the dentist. And then when they go to the dentist, I'll show you some of the options that we're seeing. So basically, this is a great opportunity, right? So like, hey mom, there's something new that we're going to start applying here or implementing. And what it is called fluoride varnish. What fluoride varnish does is it hardens the enamel. Baby teeth are very small. They're very soft, which is why baby teeth get cavities much faster than adult teeth. It's just a different type of enamel that they have, the way the enamel rods run. This is what the fluoride varnish packet looks like, and then I'll show you how to apply it. But if you take a look in the child's mouth, and if you see these little white spots, that's a great teaching opportunity to just show the mom, like, hey, do you want to pull your phone out? Do you want to take a picture of this? Make sure when you brush the teeth, I'll tell like the little ones, like smile and make like an angry dog face, go, "Arr." And really until a child is age 8, they're not able to tie their own shoes, so they have a hard time brushing really well. So let the parents know too, like it's good to help brush your child's teeth until they're 8 years old. And this is why I think it's so effective when pediatricians apply fluoride varnish. It's just having this conversation, right? Like, hey, we're gonna put fluoride on, but make sure you're getting in there. And the rule is 2-2-2. Brush your teeth 2 times a day for 2 minutes and see your dentist 2 times a year. For little ones, it's impossible to brush for 2 minutes, but for me and you, that's the measure that we want to do, is we should be brushing our teeth 2 minutes. For a little one, usually you can be in and out if they've only got 10 teeth in 30 seconds. So let me show you what the fluoride varnish consists of. Oh, this is something else super, super important, is that you want a good tasting fluoride varnish, because the first time you apply it on a child determines how likely they're going to let you do it again. So if you put on a nasty tasting fluoride varnish, there's a good chance the next time they come see you, they're going to be like, yeah, that was terrible. I don't want it. But if you have one that's actually a better tasting, then there's going to be a much better chance that the next time you apply fluoride varnish, they're going to go, that wasn't that bad. So I use a brand, and I do not get any cutbacks or anything kickbacks from him for promoting it, but it's called Wonderful Dental. The price point for this, I think, is also really good. It comes in different flavors, but you get approximately 50 of these little things, and it comes with a little separate applicator for $100. No, $50 for 100. So it's about 50 cents each. And what you do is I open this up before I see the child. Because here's the thing, as soon as they see you put on one glove, they automatically believe that they're gonna get a shot. So the less that they see before you actually apply it, the better. Okay, so this is my applicator brush. I've had some CNAs say they apply it with a gloved finger. But the important thing is, usually I apply it with the applicator. I put one glove on, I leave the other hand free. And what I do is I have this already open prior to applying it. Because that way, you're not opening this, fumbling with it, and then wondering, what are you gonna give me? And you wanna mix it for about 10 seconds. So what happens is the fluoride varnish separates, and when it separates, that kind of like gets the flavor not so good. So the more you mix it, the better it is. A lot of times what I'll do is I will just put it here on my glove, and so I'm dapping from here to here, so I'm not going over here. And if it's a 3-year-old, 4-year-old, 5-year-old, they're usually sitting on their own. And sometimes they're actually harder. So I will act like I have a 3-year-old here. And the mom's over there. I'm like, hey, we've got this really cool stuff. And I'm just gonna go ahead and I'm just gonna color your tooth. And it's white. And I'll let them smell it because it doesn't smell bad. And I'm like, but you know, if it tastes bad, you can spit it out. So it's still gonna stick on the teeth. So I'm gonna give you guys each one to take home tonight. So you're gonna brush first, floss second, and then after you brush and floss, you're gonna suck air on your teeth, just go, because if they're drier, it just kind of attaches better. So for my children, what I'll do, either I will use a piece of gauze, because sometimes they've just had oranges and they got little orange peel between their teeth, or they've had Cheerios, and I wipe it down. But I always do the front teeth first. So what I do is, these teeth from corner to corner is one swipe. And you just do this because the most common area where we find cavities on kiddos and where they get these silk crowns are these. So that way, if they say, okay, that's enough, at least you've gotten it on the most important ones. And you don't want to force it. Doesn't taste bad. Because if you force it, then they're most likely not going to want to let you do it again. Sometimes you can also like reason with them if you have a mirror to say, hey, look in the mirror. And this really shouldn't take longer than 2 minutes. I just saw 20 kiddos this morning and they just lined them up and we just like went through. Next thing you do is inside of the lower teeth. That's the second area where I noticed the little white lines. And then the last thing you do are chewing surfaces and cheek side, and it's sticky. And chewing surface and chewing surface. And it doesn't taste bad. The aftertaste is a little bit like, how would I describe it? A little bit metallic, maybe? And so that's why I say they can spit. But no one absolutely hates it. Okay, so 3 to 4-year-olds, you can reason with them. Usually you can at least do one. They spit, they're fine. Once they swallow, there's no bad taste. They can eat and drink immediately. Because this wax coating in the varnish, even if you drink water, or even if they want to rinse with water, it's still going to stick on the teeth. Like you have to like mechanically remove it. So I tell the parents, do not brush until right before they go to bed. Because then that dosage is being uploaded all day. Technically, they're supposed to wait until the next day, but I was just telling them, just do it before they go to bed because you want to instill that every night the most important time to brush is at night before you go to sleep. Now, if you have a child, let's say 1 year old, and they're on the mom's lap, a lot of times what I will do is I will have the mom hold the baby facing her, and then we'll go knee to knee, and then she will lay the baby's head on my lap. And that way she's got a view of what I'm looking at. So now I'm looking upside down, lifting up that lip, and again, the area where you want to focus is right on the gums. And that way the babies look at the mom, and you're kind of showing her with, like your gloved hand, like, hey, see what I'm looking at? These are all great looking teeth. I don't see any decalcification. Everything looks like it should be. Or if you notice, hey, there's a couple little white lines, or oh my goodness, like there's a couple breaks, they need to see a dentist. There's something suspicious. There's something super exciting called silver diamine fluoride. And you can zoom in on this because this is something you're going to start seeing more and more of. And so not to be confused with a cavity, which is usually brown in color or caramel color, this is really black. So what has happened is they have approved in the state of California for reimbursement for dentists to apply silver diamine fluoride as if it is a filling and get paid for it as if it is a filling. But this child has not had to go under general sedation. This child has not had to have a shot to get numb to put a regular filling there, because they apply it basically the same way with a little brush. The side effect is if there is a cavity, like this had a cavity, it turns it black because of the silver component in it. It's like in between these front teeth, it turned it black. But otherwise, the option might have been putting that child under general sedation and then them coming out with stainless steel crowns. So for me as a mom, I would rather not put my child under sedation, not have them have a bad experience. Yes, they're gonna have like a spot that looks like they have a piece of pepper between their teeth, but that tooth is gonna fall out. Me or you, we don't want that in our teeth. But if you've got a child that otherwise, like these little areas up here, there could be a case to say, hey, if we put silver diamine fluoride there, they might have little black dots right there. But the other alternative might be stainless steel crowns. So for me as a parent, I would rather have little black dots on my child's teeth instead of a stainless steel crown. But that's something that you might see. And that's why I bring it up, is that if people are like, wait, what is this? Like they've got this dark spot that is not the typical cavity that's normally a caramel color or a brown color. It's really black. And they say they've seen the dentist before. It's because most likely it's silver diamine fluoride. Super exciting is that now medical doctors can get reimbursed. Technically, a medical doctor can do everything a dentist can do. But most medical doctors don't want to do dentistry, and I don't blame them. But technically now there is a code that medical doctors could also apply silver diamine fluoride. I don't know if we'll ever see that in the next, but maybe in 10 years, we might see more and more medical doctors going, hey, I can arrest this here, I can get paid for it here, I'll do it. They don't have access. But we've got so many more dental clinics now available to see our patients. I think we'll probably continue to see this mainly coming from the dental side. Okay, so we talked about how many times a year you can apply it. We talked about it's perfectly safe if they say they just got it from the dentist. So a high-risk child could potentially get fluoride varnish 4 times from their dentist and 3 times from their medical doctor in a year. And that's perfectly safe. You can apply it with your well child visit. That's a good way to incorporate it, but you could also do it single standing, like if someone comes in and they aren't with a well child visit, but the medical doctor says there's a need. And once there's an order for it, you guys can start applying it. The other way to apply it besides the brush is with a finger. So I've had like one CNA tell me that I just dip my finger in there and apply it. And that can work too, right? So you just put your gloved finger in there, and sometimes that's more effective because now they're not worried about what is that slow brush? Is that brush gonna poke me? So I've done it that way just recently to see if it works, and it totally works. So find out what works for you. We talked about what causes cavities. So cavities are caused by bacteria. What happens is the sugars we eat is what the bacteria feeds off of. So a diet that is high in carbohydrates, so that could be crackers, it could be sugar. The bacteria, Streptococcus mutans, eats that sugar, and the byproduct is an acid. So one thing to tell the parents is, hey, if you put your child to bed with a bottle, make sure you take it out, wipe the gums down, even with just a burp cloth. It doesn't have to be a toothbrush. You don't want to wake them up. Or if they just only have 2 bottom teeth or 4 top teeth, wipe it down with a burp cloth. Moms that nurse or breastfeed, sometimes they don't realize that even though breast milk is natural, it's super high in sugar. So I actually sometimes see more babies that are breastfed babies with baby bottle tooth decay, even though they've never had a baby bottle, because they get up in the middle of the night, they latch on, you fall asleep, they fall asleep, you wake up, their mouth is full of breast milk. So again, keep that burp cloth in bed with you if you've got that baby in bed with you, and wipe those teeth down. because breast milk is just as dangerous as a bottle. The other thing is sugar sweetened beverages. So one thing we don't think about are the sports drinks. So sports drinks actually have a lot of sugar in them. So I've had, parents come in like, my child never had a soda. I'm like, okay, but what else? What is their diet like? Well, they snack all day long. So every time you put a carbohydrate or a sugar in your mouth, it takes 20 minutes for your mouth to remineralize. The normal pH is 7.0. So that's what our normal pH is. Every time a sugar enters your mouth, it brings it down to an acidic level, which is 4.5, and it takes 20 minutes to remineralize. So I tell my parents, if you're gonna sip on a Starbucks, sip on it all at once. Don't sip on it all day, or a big gulp, because every time you introduce a sugar, it takes 20 minutes to remineralize. But the same for children. If you give them like a bag of goldfish, let them have that snack all at once, but not all day long. So try to keep your snacks all at once to your lunchtime. Super exciting study they did on this fluoride varnish. They got it first approved for sensitivity. And so the off-label usage is actually cavities. But what they found is that when people had sensitivity, like adults, and they applied the fluoride varnish, the ions of the fluoride went in and it blocked the nerve pathway to the nerve. So it stops sensitivity. So if you have sensitivity, apply it, it'll stop your sensitivity. But they did a study up in San Francisco, and they focused on the area of Chinatown. And this is how it got passed for cavities. But they did a study where they put it on children. And then they came back 6 months later, they took x-rays. And they found radiographically, after they applied it on teeth, there was a white hardened layer of that enamel-rich, fluoride-rich enamel. So that's how it got passed kind of for like, okay, not only does it harden the teeth to prevent sensitivity, it hardens the teeth and prevents cavities. So that's, kind of the mechanism of action, and that's how it all came about. I think it first got approved in 2009, so it's relatively new. I don't know if you guys remember back in the old days when I went to the dentist, we had to put the trays in our mouth and they'd foam up, or you'd have to like swish with it for 2 minutes, and I always got an upset stomach from it. I hated it. This one doesn't give me an upset stomach, and I apply it all the time because I'm always giving training. So it's not toxic. There's some people that are anti-fluoride, and if they just refuse fluoride on all levels, it's just like that's their prerogative. Make sure when you do apply it though, okay, about 5 minutes, make sure that you document that you do it, because you want to get credit for it. And so make sure you document it. Have the doctor or the PA or the NP sign for you. There's like a little box that you want to make sure you do that. The other measure is oral evaluation by a dentist, OED. So you want to check the box that also you're telling the parent, hey, and by age 1, it's good to go see a dentist. And I think that's the biggest thing that's changed. I've been a hygienist for 25 years. 25 years ago, we used to say go to the dentist when you're 5 years old. Then about 10 years ago, it went to 3 years old. And now it's like 1 year old. And part of that is, I think the sooner they go, the better the experience, to where it's not a terrible experience going. Plus, I think dentistry's kind of evolved a lot, right? We've got options like silver diamine fluoride. So if you're waiting till they're 3 and 5 and you don't have this little option to put there, it's a lot more aggressive, a lot more invasive. Whereas if you've been seeing this child since 1 and they just got like a little spot, if they're coming in regularly, some dentists will just continue to watch. Like, hey, let me keep an eye on this. So you're gaining trust with the parent, you're gaining trust with the child, to where eventually now that you're just saying like, hey, now I have to give you a little pinch. But a lot of things can be done with minimally invasive dentistry. So that's really changing our paradigm of what it used to be. So this is just Tiny Smiles. It talks about teeth, what to do, first tooth, first tooth, and 3 to 5 years old. Let's see here. So we talked about diet. Sugars are what causes the cavities. Bacteria are passed from caregivers or through family members. They did a study and they found that chewing sugar-free gum with xylitol. So xylitol is spelled Xylitol. It's basically a non-sugar, but it's a natural sugar that the bacteria can't metabolize. So it lessened the amount of bacteria in a mom's mouth. So they found like a mom that had a newborn, she passed on fewer cavities because chewing that xylitol gum not only helped neutralize her acidic environment, but it reduced the amount of bacteria because they couldn't metabolize and grow. So chewing gum is actually good. Make sure it's sugar-free, not sugar gum, but Trident, Mentos, many of them list xylitol as a sugar in there. Okay, any questions? We did this in 30 minutes.
Wow.
So yeah, so in 30 minutes, I think